How do you prepare for an SRS-2 assessment? Are you curious about how to get ready for an SRS-2 assessment? Let's break down the steps to make the process smooth and effective. The SRS-2, or Social Responsiveness Scale, 2nd edition, is a tool used to assess social behavior related to Autism Spectrum Disorder. It helps identify social challenges and strengths. First, it is important to understand the purpose and format of the SRS-2. The assessment consists of 65 items that evaluate social behaviors over the past 6 months. It uses a 4-point scale to rate how often certain behaviors occur, from not true to almost always true. The SRS-2 focuses on 5 main areas: social awareness, social cognition, social communication, social motivation, and restricted interests and repetitive behaviors. There are versions for preschool children, school-age children, and adults, including a self-report option for adults. Next, gather observations and examples of social interactions. Think about specific instances of communication, patterns, and routines. For parents or teachers filling out the form, recalling behaviors in different settings like home or school can improve accuracy. Adults completing the self-report should reflect it on their social experiences honestly over the last 6 months. Understanding the context of the assessment is also key. The SRS-2 is part of a larger diagnostic process for Autism Spectrum Disorder. It is not a standalone diagnostic tool, but provides valuable information that complements clinical evaluations. Knowing this can help ease any anxiety about the assessment. Prepare for the time commitment, as the questionnaire typically takes about 15 to 20 minutes to complete. Setting aside uninterrupted time allows for thoughtful responses without feeling rushed. Consider language and accessibility needs as well. The SRS-2 is available in multiple languages, including Spanish, and can be completed on paper or online. Ensuring the version used matches the individual's language and comprehension abilities supports accurate results. Be open and honest when answering the questions. Accurate ratings depend on truthful responses. Approach the assessment as a tool to better understand social behavior rather than a test to pass or fail. This mindset helps highlight areas where support may be beneficial. If you have questions about how to complete the SRS-2 or interpret its results, consulting with a clinician, psychologist, or autism specialist can be helpful. They can explain how the results relate to the Diagnostic and Statistical Manual of Mental Disorders criteria for Autism Spectrum Disorder. Preparing for an SRS-2 assessment involves understanding its role in evaluating social responsiveness, reflecting on social behaviors with specific examples, allowing sufficient time for completion, and approaching the process with honesty. This preparation helps ensure the assessment accurately reflects the individual's social strengths and challenges.